welcome back, Paramedic Project. Thanks for joining us once again. Today, final episode on drug administration. So let's talk about the final big points on administering drugs. Now, the first one I'd like to share with you is obviously about practicing drawing up these drugs. Now, the more we can practice, the more we can get our hands on the actual equipment, the better dexterity you'll have when it actually comes to the time when you have to prepare them in real time. So that's a really important point. Now, if you can't get the actual equipment in your hands, I think a great thing from there to do is actually to set the equipment up, maybe at university or when you go out on road to do some of your placements, set the equipment up, take photos of all the equipment you need for every drug, every route you need to administer those drugs, and then maybe a photo for an adult patient and pediatric patient as well. So you'll have a whole collection of photos maybe on your phone where you can then just refer to them when you've got some downtime. That way you can start establishing a bit of a mental picture in your mind of the equipment you need to pull out of the drug kit every time you draw up a drug and prepare it before administering it. Now, it's just like any other skill, like intravenous cannulation. You have a mental picture in your mind of the equipment you need to prepare before you actually do the skill, and drawing up a drug's no different. There's equipment you need and you just have to become familiar with them. So that's the first big point. Second big point is the concept of labelling syringes. Now, in my experience, to avoid drug errors, every single syringe, every single drug, whether that be a flush or any other type of drug, whatever's in that syringe needs to be taped to the syringe. That's the easiest way to label it. And if it's been double diluted, then we need to mark the syringe really clearly and actually write the drug on the syringe with a permanent marker. And that includes the actual amount of drug that's in the syringe. So that's a really important point. And if you find any syringes without anything labelled or without anything taped to the actual syringe on scene, the best thing to do is just to discard those syringes, empty them out, discard them, and that way we are sure we're not going to make any big drug errors. So that's the second big point. Third big point, and I think one of the most important points about administering drugs in the pre-hospital environment, is that there are a lot of big egos out there. And in my experience, a lot of paramedics like to really try and remember every drug, every dose for every age of patient and have it just sitting at the front of their mind so that you can recall it really quickly, and it's fantastic on scene when you can actually do that. The important thing to realise is that if you're not sure of the dose of the drug that you're about to administer to someone, just stop and check it. And that means you need to be a little bit prepared in the first place and have either an app on your phone or some type of information there with you in your drug kit or in your pocket where you can actually check that you're actually administering the right dose. It's far better to actually take a few more seconds to check the actual dose of the drug before administering it than actually administer the wrong dose. Aviation uses checklists, and I think we should start doing that too, so drug checks is one of them. It's been Paramedic Project. Thanks for joining us once again. Find us on social media, and we'll see you next time.